What is the ICD-10 code for obstructive sleep apnea? If you or someone you know is struggling with sleep apnea, it's essential to understand the coding system used by healthcare providers to diagnose and treat this condition. So, let's break down the specifics of the ICD-10 code for obstructive sleep apnea. Obstructive sleep apnea, or OSA, is a sleep disorder where your airways get blocked while you sleep, causing you to stop breathing multiple times throughout the night. This can lead to symptoms like loud snoring, episodes of breathing cessation, abrupt awakenings with gasping or choking, morning headaches, and excessive daytime sleepiness. The ICD-10 code system is a way for healthcare providers to classify and code diagnoses, symptoms, and procedures. For obstructive sleep apnea, the specific code you need to know is G47.33. This code, G47.33, is used for diagnosing and billing obstructive sleep apnea in both adults and pediatric patients, excluding newborns. It's part of the broader category of sleep disorders under the G47 designation, with the 33 specifying that it's obstructive sleep apnea. When coding for OSA, healthcare providers must verify the diagnosis through appropriate diagnostic criteria and testing. They need to document all relevant clinical findings and symptoms in the patient's medical record. It's crucial to use G47.33 specifically for OSA and not for other types of sleep apnea. Here are some other related codes to keep in mind. G47.30 is for unspecified sleep apnea, G47.31 is for primary central sleep apnea, and G47.39 is for other sleep apnea not classified under any specific type or cause. Using the correct code is important for insurance coverage and proper treatment planning. For instance, if you're diagnosed with OSA, this code will help ensure that your treatment, such as continuous positive airway pressure, CPAP therapy, or lifestyle changes, is covered by your insurance. In summary, if you're dealing with obstructive sleep apnea, the ICD-10 code you need is G47.33. This code helps healthcare providers accurately diagnose and treat the condition, ensuring you get the right care and coverage.